Thank you so much, Nadia. It's wonderful to be hosting this panel as we talk about the digital health revolution. So excited to see all our panelists here. I'll ask all our panelists. I think you're all now unmuted, so that's fantastic. I want to introduce our panelists to the esteemed guests of today's conference. We have Ben Asanasan, who is the CEO of Tune Protect Thailand and also the head of our health pillar at Tune Protect Group. We also have Mr. Tommy Pichet, who's the managing director of Actuarial Business Solutions, an amazing actuarial firm based in Bangkok, Thailand. We also have Mr. Christopher Dennis, who's CEO of Luma Health Insurance. Thank you, Christopher. And we have Dr. Thomas Lesko, who is the Chief Medical Officer of Europe Assistance Group, and he is calling in today from Paris. And finally, to round out our panel, we have Dr. Jeremy Ting, who is the co-founder and managing director of Nurluri, which is a mental health and wellness digital service company. So welcome all our panelists. It's great to see you. And I just want to start off talking a little bit about the digital healthcare revolution. Before we had the pandemic, there were some things that we did digitally in the health world. We were starting on digital records, medical records. Hospitals and doctors were trying to put those together. Obviously, there were a lot of concerns with privacy and the customer experience with digital healthcare records. And there were some other things too. Telemedicine was more of a niche service, but along comes the pandemic and it forces us to accelerate at an amazing pace just to offer all these services to people that don't want to, A, leave their home or don't want to enter a hospital for risk of infection. So as we see, as the pandemic accelerated most of the digital transformation of companies, the pandemic also accelerated the health innovation, and there's been some amazing innovation that's been done in a very short period of time. For example, telemedicine. You can access telemedicine from just about anywhere on any device. The services are easy. You get choices of chat through wonderful third-party services. You can get video. You can also, if you want to, get audio through telemedicine. Any way that you want. The customer has a choice. There's also what's called digital health assessment scoring now. So many insurance companies like Tune Protect are looking at this very closely because they want the data. They want to go after the customers. They want to get their data, and then they want to provide products and services that are customizable to them. Also, personal smart devices. Everyone now, if I were to look at all your wrists, you have a smart device, an Apple Watch or a Garmin device, or something like that that counts steps and things like that. But soon there's going to be so much else. It can look at blood pressure. It can look at your heart rate. It can look at, right now, it can even look at your blood sugar for diabetes. So some amazing technology there. Also, and Dr. Jeremy is part of this, there are online wellness programs. There's so many sprouting up that are easy to use. They're used in conjunction with healthcare products. So it's an option to look at your diet, your personal diet, your mental health, and so many other aspects that customers can use as a valid service. Also in the underwriting world, there's advanced risk assessment. There's data now available so you can look at products, you can assess risk faster, and you can offer better pricing. And then the diagnostic equipment. Medical technology keeps improving faster and faster and faster. And there's new equipment and it can be done much cheaper. And so there's additional data there that's flowing in and out of the healthcare systems. And last but not least, there's integration with other online services, delivery services. A lot of telemedicine companies have integration with delivery services. And I'll say this, AirAsia Eats is one that we're just launching in, or we did launch in Malaysia. We have Grab, we have some others that are also integrating with the healthcare services, and that's very exciting. So what I'll say is I want to bring in Ben as a CEO of a health insurance company, of our company. What do you think, Ben? What would you like to add? What some of these trends that you're seeing are intriguing to you?
What you said, all of that is spot on. And I think what I would add is, taking a step back and looking at it, what I think is changing is that the customer journey and customer experience itself. In the past, you used to, and obviously it's during even my time as well too. You used to go to the doctor or the doctor's office, and then they'd write you a prescription on a piece of paper, and then you get a lab test. You have to go to the hospital. A few days later, you go back to the doctor to get your lab test results, and then you have to schedule that, and then go back to the doctor again, and then maybe you get some prescription, you go back to the pharmacy, you go home, and then you go back again. So a very archaic process. I think digital, it has changed all this, and especially the acceleration of COVID has changed all this too. Now, quite honestly, you could just do a telemedicine call, and then, after the telemedicine call itself is done, the prescription could be sent to your house, in different markets as well too. So I think what's changed is that customer journey experience, and what we see across, not just Thailand but other markets too, is the entire network is changing. Not just with the insurers, but with the hospitals itself, the integration among that. So I think it's an exciting time, given the healthcare standpoint on the digital side, especially with the COVID situation. Although an unfortunate situation, I think what it's if you look at as a glass half full, it's gotten people more linked into health, more awareness of health, but also it's actually got the integration of digital has actually gone faster, like you said. So I think it's that integration of that customer journey and the ecosystem change.
Exactly. I think Michael Waits talked in the last segment on technology that we've moved from customer service to customer experience. And we're doing that in the health world too. The customer journey and the experience is so important. It's more than just service and being a number. It's all about how can the customer feel comfortable and integrated and use the technology they want to get the services they need with health, and also to get to provide data, share that, and also use their own data to be able to get some amazing products and services, products offered by insurance companies and services offered by healthcare providers. So thanks for that, Ben. Having said that, I'm going to launch into our first question, our first panel question for our esteemed panelists. And the first question that is showing is, what key trends from the COVID pandemic do you see in the ASEAN health market that will change your business strategy over the next 3 years? I want to direct that question first to Mr. Christopher Dennis from Luma Health Insurance. Christopher, what do you think is really going to be changing your business strategy over the next 3 years?
Thank you very much for the question, and thanks for inviting me today. I'm honored to be part of this panel. I'm not sure I would say it's changing our business strategy, but it's definitely speeding up the strategy on some areas. So I think the three major trends that I would like to highlight is and it's not all digital, but obviously digital is a big part of the solution. But I think first of all, what we've seen in the markets we're active in, which is Thailand and the markets around, we've seen an increased awareness of health insurance, the need for insurance, and an increased focus on health management in general. I think we have, and that has led us to speed up the way that we're going about some things. I think Prasanna mentioned earlier the hyper-personalization, moving from being a protection provider to be a true healthcare partner. I think we'll probably get into more of that with the doctors on the panel. So I'm not going to go into that too much, but that is, again, a trend that has accelerated. And that all, of course, leads to the digital utilization of all the digital health solutions that you mentioned before. We've seen a huge uptake in telemedicine, and I think that is super important. I mean, it's enabling us to fund more treatment because the cost is typically lower. It's enabling us to be much closer to the customers. Obviously, we don't provide the telemedicine solution, but we pay for them. and it creates a lot more flexibility in what we solve. So I think the key bit and where we really have to invest more and pay and do more work than we probably had expected now is on telemedicine and the whole digital set of digital health solutions around that.
Oh, thank you, Christopher. You're right. You need to put the customer front and center. As a health insurance provider, the customer and bringing in various partners is key to that customer experience, as we've talked about before. Personalizing that for the customer, knowing what the customer wants, being ahead of the market to attract more customers in a faster way and an easier way is key for your business. Clearly understand that. So thank you for that. I'll switch over now to a different side of insurance, which is the actuarial side. And I'd like to get some thoughts from you, Tommy, on what you think in the ASEAN health market is really changing and how that's going to impact your business strategy over the next 3 years.
Yeah, thanks, Fred. Yeah, thanks for having me in as well. I think this is a good question, and like just what Ben just said, that I think it's also about the customer journey, and then how to integrate the number. You know, right? I'm the number guy. Yeah. So how to integrate the number actually into the part of the customer journey. So what I can see, the key trend here actually become the three things. Right? The first thing is about the omnibus channel. From the perspective of the one who decide the product, right? I can see that I think we're gonna have to got the several channel branding together, which the online can be the key. You know, right nowadays, it's not just only you're gonna have to sell everything to the online and then cross sell with the online. But let's say we can divide the customer journey to be different part, and every part or step in the customer journey can have the online inside, which actually lead to, I mean, the key trend number 2 here is that the customer always compare, you know, searching all the information, you know, right? And then also seek for the review. I think in the past, right, I mean, people kind of get the reference to ask friend, right? And then trust the agent, and then you say the trusted agent say this and say that, and they believe it. But nowadays, doing the customer journey, they also try to get better understanding what is the product. They can actually search through everything, and then they can get some education through the online journey as well. So one of the part is the review from the customer itself. If we actually have some kind of the platform to kind of allow the customer to keep some review of this one, you know, right, is to make the product more valuable and give trust to the customer, because the insurance product is simply the paper, right, and then the trust. Yeah, so this kind of the review can be kind of increase the trust to the customer, and then can cross sell easier. That is the number 2. So the last one of the key trend here is about the specific target market. I'm gonna see from the product perspective, right? So we're gonna have a more specific on niche market when we actually design the product, especially for the health market. In the past, it's more like, I mean, we come to the digital, and then we can make the product actually more, you know, in the niche market, in the nimble market, launch the product faster, cross sell faster, and then, you know, right, I can have the, what can I say, like in the past, right, you're gonna have to get the one very huge fixed cost in order to get one product. But nowadays, with the digital channel, etc., and then with the IT technology, you can even tailor-made some of the product. But absolutely, that also involved with the regulator as well, that allow you or not on this one. But this is a key trend for the next 3 years. Yeah. Total
Thanks,
sum up
Tommy.
is omnibus channel, yeah, review, and then the specific target market.
No, that's great. That makes total sense. I'm hearing that the customer is going to have more control. The products are going to be more personalized. You have the data. The customers really want to be able to choose. That's something we do at Tune Protect now with some of our products. We're giving them choices. And because we have the data we need, because it's so digital and so available, and that's going to be great. So thank you for sharing that. I'm going to move on to the next question now for our panel. And this is an interesting one on pretty much the monitoring of health data. We've been talking about this data, but now that consumers are monitoring their own health more during the COVID pandemic, how do you plan to leverage this data to grow your business? And I'm going to start off asking this question to Dr. Jeremy Ting from Naluri with a mental health perspective. How do you use this data?
Thanks so much, Fred. And I think this is a little bit of a two-part question, right? And the first thing is obviously, how do we request data? And maybe as an extension of that, how do we store, process, and protect that data as well? And I think particularly in Southeast Asia, getting informed explicit consent is definitely going to be the most important thing, and making sure that we abide by it. And the key thing here is to kind of make sure that it is explicit and really informed as well. What we try to do, besides obviously abide by the local laws, is try to write the terms and conditions and privacy policy in ways that can actually be understandable by the end user. And beyond that, what we are trying to do as well is to be as much as possible Hipaa compliant, so using US standards about how you treat data, as well as trying to be GDPR compliant as well, using sort of EU-driven sort of a regulation on personal data as well. And this will include, obviously things such as end-to-end encryption and security protocols, and internal stringent protocols as well that needs to be put in place. Because I think in health, more so than any other business, is that the trust of the individual or the customer is not very easily earned, but it's so easily destroyed. Now, how do we use it to grow? At least for us at Naluri, we really use the data to try to enable us to tailor our services to a more individualized level, and to do that at scale. I think a lot of people have talked about the personalization of care, and we strongly believe in that as well. And we do this basically in three ways, right? Firstly, we are able to now more proactively assess risk. So for example, in mental health, depression is a big topic. And if we're able to be more proactively assessing depression from natural language processing tools, we're able then to almost flip the model of standard mental health support from something that's very reactive today to something that's much more proactive and better to intervene individuals much earlier on. Secondly, through all the interactions, we're able to create a massive data set and roll them up into what we call digital biomarkers, and use that once again to predict health outcomes, to predict behavior change, to personalize the health coaching and advice and nudges that we give each individual, giving them a much better chance to achieve their own health goals as well. And thirdly, then we use this data to create decision support making tools. A lot of work is being done in the clinical sphere, such as using AI tools with X-rays to predict lesions for radiologists. But how do we use that in behavioral health with ancillary care, with psychologists and dietitians and fitness coaches, working in tandem with traditional clinical systems to be able to help them work at a larger scale, be more efficient? Because that's really important in a Southeast Asian context where we have a massive supply constraint of dietitians and psychologists. So if we really need to address the larger problem, we need to be able to empower these individuals to be able to serve a much larger population as well.
Thank you. Thank you, Dr. Jeremy. I'm hearing a lot about the compliance matters, but at the same time, it's exciting that this health, especially biomarkers in the world of mental health, is come a long way. And there's a lot you can do with data, as long as there's consent, and to use that to grow your business. So thank you for that. I'm going to switch back to Christopher. Just any thoughts on your data and your particular customer set, and some of the things that you're planning to do to leverage that data?
Absolutely. I mean, thank you, Jeremy, for this very thorough walkthrough. I think that, if anything, shows what is possible now and what is becoming possible. Now, from the insurance side, of course, there's always been a natural wariness on behalf of the customer of sharing these medical data, because are we going to use them to reject cover? Are we going to use them to reject claims? And that's obviously the last thing that we want to do, right? I'm not going to go in so much into how we're going to request the data, because I do believe that the customers will open up for sharing the data if we provide value. So what these data enable us to do is to provide better health management, better health outcomes for the customers, which in turn can lead to reduced health expenditure over time. And I think that is really, really important. If we can demonstrate that to the customer. If we can win the customer's trust on that, then the customer will be okay to share certain data, provided that these data are treated appropriately, just as Dr. Jeremy was saying just before. But I believe this is really about outcomes. We've seen some simple initiatives 3 years past where insurers wanted to promote a healthy lifestyle. So if you join a gym, you would get a discount, stuff like that. I think customers are looking for much more than that. Customers are looking for us to, together with the health providers, to take an active role in improving the management of the health. And as I said, we need to demonstrate that we can do that. We need to demonstrate that we can treat the data properly. And at the end of the day, what the data will allow us to do is actually not to just take on the good risk, but to price risk correctly, and more importantly, to provide protection for risks that today we probably wouldn't insure. Today, lots of policies have exclusions. In the future, what we want to do is to avoid having exclusions, but price this risk correctly and cover these conditions also.
Thanks, Christopher. That's great. I'm hearing some things about controlling costs and better cost management, and also opening up the ecosystem with the data available to offer some more innovative services. On the cost side, and Ben, you have to manage costs very well at Tune Protect. What that's an understatement, right? But what do you say? How will the data help you manage costs within your operation?
Thanks, Fred. Yes, great question. I think for cost-wise, as we understand the customer better, as we have more data on the customer, and the data can come from multiple means. It doesn't have to be just health data. It could be eating habits data, or where they're going, or where they're traveling data. So the more data we have, it'll allow us to better underwrite that risk, as Chris mentioned. And with better risk management, obviously we can offer some more products. We can offer a larger, more products to the market, and I think we'd be more open on the risk. And I think from the digital standpoint, for what I see, from a cost management, is that it allows us to to be more, I guess, to be more innovative, on how we're doing our product development risk management, because the more data we have, we'll be able to open things up. Now, from a cost standpoint, again, it goes back to that risk management standpoint, in the sense of, we've got more data, and then we're able to price things correctly, rather than having a lot of different assumptions or loading factors. As Tommy would know, not to put another 50% or 60% loading factors on things, rather than we know this customer, we know you, Fred, we know how you are, we know your lifestyle. It goes back to what Tune Protect stands for is, we're linking into your lifestyle, we're customizing for you. With that data, we can customize a solution for you, like some of the products are more customized that we're developing now, and without loading factors. So the pricing will be spot on for yourself, rather than pricing for somebody age 50 across Thailand itself. So I think that's it's a benefit for the customer. From a cost perspective, we'll be able to price it better. I think it's at a high level there, Fred.
Oh, thanks, Ben. That's great. So I'm hearing a lot of great things about data, and what we can do with the data, how we can manage it, and better serve our customers and improve their customer journey. I want to jump to the next question, which is really a hot question. This is all about telemedicine, and we're going to look forward to hearing from Dr. Thomas Lesko. But the question is, the COVID pandemic has created a new market for telemedicine. How do you plan to leverage this technology? Because you're at the forefront of this, Dr. Lesko. How are you going to do this in the long term with telemedicine? What's going to happen with telemedicine?
Yes, thank you very much, Fred. It's a very, very interesting question. And we saw definitively an increased demand, not only on teleconsultation, but in telemedicine in general. Europe Assistant was one of the leader assistance company in the world. We performed more than 120,000 teleconsultation last year, which is one teleconsultation every 5 minutes. So today, telemedicine and teleconsultation in particular increase the access to medical services, giving more people access to healthcare, reliable diagnosis, and better treatment. But tomorrow, the future of telemedicine is even more exciting. Tomorrow, telemedicine will use some home-based connected devices. Artificial intelligence will also simplifies the life of patient, doctor, and other hospital staff. And so definitively we are at the beginning of something that will definitively accelerate the deployment of telemedicine, including many other solutions compared to teleconsultation itself. Just to give you an example, in June 2021, Europe Assistance South Asia launched Health2Go with Tune Protect Thailand for their customers with travel or health insurance. And this Europe Assistance teleconsultation service is planned to be deployed in Malaysia and Singapore. We use our group IT technology and a local pool of doctors available 24/7. And just to highlight the fact that it's really accelerate, in a few months, we will include some more capabilities and will include more than health capabilities in probably next November with a recruitment of psychologists, psychiatrists, and perhaps in a few months, some other specialists. And I fully agree with what has been said by Christopher. In fact, it's not only, telemedicine or teleconsultation itself, but no, we try to integrate all the medical services in one, digital solution. So our short-term vision is really focused on differentiated solutions, no app to download, easy and fast integration for B2B partners with white label possibilities, but our long-term, mid and long-term vision include really the full integration of telemedicine in the 360-degree coordination ecosystem. Tomorrow, patient will not only want teleconsultation, but will also want probably second medical opinion, vital sign monitoring, symptom checker to assess their own health, not only when they are sick or ill, but for preventive medicine also. So really the goal is to integrate all this teleconsultation and all the different, I would say, telemedicine solution in one fully integrated solution. And tomorrow it will also integrate non-medicine solution. All the assistance solution will be integrated and will be available for the clients for preventive medicine, treating medicine, and access to better care.
Thanks, Dr. Lesko. I truly agree with you that we're just at the beginnings of telemedicine. It went from something niche that was kind of, thought of as maybe just a small development to something that's really now gotten much more acceptance. And now we're moving into full integration. You mentioned symptom checkers, you mentioned medical second opinion, how that's all integrated and make it easy for the customers so they don't have to go to 3 places. They can go to one area, they're getting their consultation. They can also check their symptoms first, then move into a consultation. And then even after the consultation, if something's serious, they might even go to like a medical second opinion. So that's great. Thank you for sharing that. Really exciting technology and advances in telemedicine. I'm going to go to the next question, and this is our final question before we jump into some Q&A. But this is one that I'm going to open up to several panelists, and it's an overarching question. It's, where do you see the customer-provider relationship for health over the next 3 years, and what are some of those challenges? That's the next question for our panel. So I'm going to start off with Dr. Jeremy Ting from the Lurie. Where do you see this customer-provider relationship, which is key? And when we talk about providers, we're talking about mostly, the doctor and the patient. Where do we see this going, and what are some of the challenges in the healthcare digital era?
Thanks so much, Fred. I think the COVID pandemic, right? I mean, it's definitely shaken, I think, the demands and the dynamics of the provider and the patient quite a lot. I think firstly, at least from my part of the world and the industry that we're in, it's definitely shone a light on the importance of mental health, where traditionally it's been viewed as a lot of stigma. And I think in the traditional world, there have been lack of access, the worry about walking into someone's clinic, whereas now through telemedicine and the emergence and the maturity of telemedicine as well has blown up. And secondarily, I think also how do we then think about chronic disease treatment at home, because people have the fear of going to the clinic. So I think more and more this really is rolled up into an overall trend that has been happening over the last decade or so, of moving care out of the walls of the clinic and the hospital into the community. But I think the COVID pandemic really has accelerated that, and at least the portion that is most easily accelerated, right? The follow-up, the chronic disease elements of it, as well as doctor-patient encounters that can be done virtually and remotely has definitely been accelerated. I think in terms of challenges, and to make sure that this sort of trend continues, and maybe areas of opportunity as well, right? I think the first thing is who will pay for these services and who will continue to pay for the services. And I think there is a big role in, I guess, private health insurance. And I think this is an area where obviously Tune Protect is innovating a lot in, but how can this be sustained over time? How do these, reimbursements for mental health, reimbursement for telemedicine become standard reimbursables and as part of the product design as well? And I think it's the conversation between insurers and reinsurers as well that needs to change, and how regulators will accelerate some of these new products in the future. I think the second thing is really about trust, right, and quality. There's going to be a ballooning of digital health solutions trying to capture this opportunity, but how do we make sure that we focus on clinical outcomes, we focus on evidence, we focus on quality infrastructure to make sure that we're not going to become part of a future that has 10,000 solutions, but we're not quite sure which one to actually use. And I think finally, most importantly, in this new future, I don't see digital health as just apps. I think it's an entirely new future where the entire care model is different. And important thing is, how do we coordinate between that out of the hospital in community digital solutions, but how do they coordinate with the traditional brick and mortar clinics and hospital as well? Because telemedicine can't take over all doctor-patient consults. A lot still needs to be done in person, but that coordination and that joined up care is going to be really important if we see a future where very patient-centric and very coordinated as well.
Thanks, Dr. Jeremy. Yes, I agree that there will be always things that telemedicine cannot do, and so that's very important. I'll switch it to Tommy, and your customer-provider relationship is more about your customer is the insurance company, the reinsurance company, and you providing actuarial services. What do you see the challenges? Like, can you give us just one key challenge that you see coming up in the next 3 years?
I think it's the integration of the healthcare prevention. Yeah, because I once actually see some kind of strategic trend, right, in future for the next 5 years ahead that actually about they will not have enough, the hospital, or not enough bed, in the hospital. So I think the most thing that also how to integrate the insurance with some preventive healthcare or preventive activity, and the IT gadgets actually can help to collect the data or statistics individually, and it's gonna like something like customization or personalized to each individual, including the health education to increase the awareness. Because in the past, the agent or distribution channel always try to increase or raise awareness, right, by talking, by kind of give the example, etc. But right now and in future, it's gonna be like customers search through information, know something from social media, and then they're aware for themselves. So the most, influencer of the customer right now, it's going to be the customer themselves when they actually kind of get all information and then educate by themselves. Yeah.
That's a good point.
Customized. Yeah.
Thank you, Tommy. It's true. The customer being more in control of their own decision making, they're going to want to, and being in control of their data when they share that. So a company like yours will be able to take a lot of that data and make much faster decisions and offer them interesting products and price those, more importantly, price those at a very competitive rate, and something that involves, as customers become more aware of their own health, they'll be collecting more of their data, which can be shared. And obviously that will benefit companies such as yourself. So thanks for that. I'll now just go back to Dr. Lesko. We just mentioned telemedicine can't solve everything, but what do you see as kind of the key for the customer and provider like yours, like your assistance and telemedicine service? What's going to be the key challenge, one key challenge over the next 3 years?
Regarding telemedicine, the key challenge will be to be able to deliver a very fast and accurate and reliable services in telemedicine, and not only focus on GP, but also to offer a larger scope and medical specialties. It will also be linked to the other services that we can offer, not only telemedicine, but how we can deliver some online medical prescription, perhaps try to get the drugs directly to the patients, and then monitor if the patient is taking the drugs or not, and try to reassess. So it's a few years ago, telemedicine was a purely, I would say, a medical consultation with a phone or video chat or video, and now telemedicine will be completely embedded and integrate in a full services, medical services, including different solution and different devices. So really, telemedicine will be part of the full customer, full patient journey.
Thanks, Dr. Lesko. So what I'm hearing is diversification. You're going to not only have integration of various services, but you need to diversify. You need to find new innovative ways to tie both the telemedicine plus like another service, like, as you said, pharmacy delivery, or maybe home healthcare delivery, or other ancillary services. So that's really interesting to hear. And I definitely agree with you on that. All right, well, we're going to start with our Q&A now, and I'll field those for any of you that want to answer the question first, and just raise your hand on that. But we have our first question. How prepared do you think Malaysia at large is ready for digitalized healthcare? Would anyone like to answer that question from the panel on Malaysia?
Maybe I'll take that since I'm from Malaysia.
Sure.
That would be best.
All right.
I think by and large, my short answer is I think they are ready, and COVID has definitely accelerated that readiness. I think you go back 5 years ago, both the payers and the providers in the industry was always thinking about digitalized healthcare, whether or not it's the claims processing in between the payer and the provider, or from the provider side as well, right? Doctor booking, teleconsults. But a lot of people back then were quite hesitant, right, to adopt these technologies. But I think today, every hospital chain is building their own version of it, or buying the services. All the healthcare insurers I know are investing heavily into digitizing their core processes as well. And at least from my perspective, we are seeing a huge surge of people seeking, I guess, traditionally very stigmatized care, as well as not only psychologists, but also in the ancillary care that you just mentioned as well. When people think about teleconsultation, they normally think about doctors, but people are talking to fitness coaches, people are talking to dietitians as well. I think what is lacking a little bit is maybe beyond just this narrow usages of digitalized healthcare. How do we kind of scale it, right, so that it actually becomes an end-to-end experience? I think still it's very one-time usage, very niche populations that uses. But I think we're not too far from when it's going to be widely embraced by everyone in the ecosystem.
Oh, thanks, Dr. Jeremy. Good, very good point on that. I personally believe, I think Malaysia is getting ready. At Tune Protect here, we're going after the millennials. Millennials make a huge segment of the Malaysian population. We're also going after what's called the B40 segment, those that are underserved in the healthcare markets, and we see a big potential for that as well. Not only just for mental health services and ancillary services, but more specialized and niche health products. So thanks for sharing that. Okay, we'll go to the next question. Do we have another question? All right, this one. Will the health data we can now get or eventually get from smart devices be enough to help price simple insurance products? Now, I think, Tommy, you talked about this. This has to do with pricing. What do you think? Is it going to be enough? Just the smart devices, not other data like incidence rates or prevalence rates, but just the data we get from smart devices. What do you think, Tommy?
Yes, I think it's nothing is perfect. I think for the data in the way of the pricing insurance product. So the way it is about the data and modeling, and two things actually kind of customize and then make it together. So when when we have more data, the more detail we have, we can make the pricing, more efficient or more customized into that. So to answer in this question, I think it's enough as well. But it's enough for now. But if we want it to be tailor-made in more detail to the customer in future, I think we're gonna have to get more data. But I just want to give some example, right? It's not that really like a data science that we're gonna have to get the big data itself, right? I think it's also up to the way we see how to kind of pricing the forward looking, how to get the customer journey into the pricing model. So data is a part of the pricing model. It's just about the model itself and how we want to give the value added into the customer kind of product from the perception of the customer itself. If the perception actually higher than the price itself, I think that product is sellable and is very popular. Yeah.
Oh, thank you, Tommy. That's great. I hear a lot that it might be a combination. I don't think the data alone in our smart device is going to be enough. We still need that experience from companies like yours that have years of experience, but it's going to have to be more recent experience, and it's changing a lot. And I think that's where we can get more data faster and more recent data that I think will help pricing overall. So thanks for that. Do we have any more questions from the audience? It looks we've got one. That one I think we had already before. So we answered that about the challenges. Maybe Ben, since you didn't get to talk about some of the challenges for the insurance company, why don't I just segue into you on what you think basically our customers, our insurance customers, and us as an insurance company, what do you think are the key challenges to finish out the panel?
As we look at digital now, I think the key challenge is that one is it's that balance. We talk about all this data now, and then it's that overload of data that Tommy was saying. And writing off of what Tommy was saying a little bit there is it's going to be an art of using this data and integrating that data together. You're going to get geocentric data. You're going to get health data. You're going to get eating habits data. So what do you do with all this data, and what's the intercorrelation of the data? So it's modeling that. So it's an art. It's going to be an art on that standpoint. But it's also going to be that balancing act too, because again, as everybody in insurance knows, we're in a regulated environment, and data privacy is coming more and more. We got PDPA rules coming into Thailand, and I think in Malaysia as well too. So what level of data can we use and not use, and then balance that. Because I think that again the borders have been skewed a bit and then opened up more, where we can use more data now, and people are more open to using some things like social media data and that for underwriting requirements, starting to look at that as well too. But there's a limit in the sense of, all right, what is too much, what is infringing on data privacy. And I think that is still going to be a debate. It's going to be the push and pull within the insurance industry and the health industry there too. We want more data. We want more. The providers want more data, but the customers are willing to give it up to a point too. But then we still need to extrapolate that. And this is where firms like Tommy still has to come in the sense of an actuarial extrapolate that. So that challenges it. So in a nutshell, I would say it's that balancing act of how much data that we can get and use with managing data privacy, but also getting customizing things. And it's the art of that linking or in that data together on intercorrelation to develop some new products, but also services that fit to the customer lifestyle. In the end, it has to be about the customer. It has to be about their, fitting into their lifestyle to go forward and being better for their lives in the future. And that's when, taking all this into perspective, we have to always take a step back in the sense of how we're going to use this to make the customer experience better. That'd be my sort of summary there, Fred. Thanks.
No, that's great, Ben. So I want to round out by saying the COVID pandemic has definitely accelerated not only digital transformation, but most importantly, digital health transformation, awareness about people's health. There's new exciting technologies we've talked about today. We've seen from very different perspectives on challenges within the sales side with Christopher, within the actuarial side, within the mental health and services side, within the telemedicine side, and finally to round it out within the insurance side. So I want to thank all of you today. The panelists were fantastic. And remember, we are not just breaking boundaries, we're going beyond boundaries with health at Tune Protect Group. So thank you very much, and back to you, Nadia.
Thank you.
Thank you.